Okay, so welcome to our community partners meeting for July. I'm thrilled to have you all here. Here's a quick overview of our agenda. So first of all, I'm Liz Cairns. I'm the Director of External Partnerships. Most of you know me, but if you don't, hi. I'm the leader of this program and your contact point for all things partnership. Always happy to help direct you if you are trying to figure out how to find things at the partnership. So today we're going to just quickly do a quick overview of the partnership and the program, just for new faces. We're going to talk about a new resource that we'll be launching shortly called the Safe Locator. We'll do a partner spotlight with our partners in Utah, USARA, and talk about a few upcoming events and resources, and then have our usual kind of open share and question and answer at the end. Okay, so quick overview for those of you who don't know us well. Partnership to End Addiction is the result of a 2019 merger between two of the oldest organizations in the field, Center on Addiction, which was formerly known as CASA, and the Partnership for Drug-Free Kids. We are focused on helping the helpers, so that is we're shoring up systems of support around people who struggle with substance use, both at the level of families, parents who have children of any age who are struggling, as well as more macro level interventions such as policy research and state level organizations. This program, Community Partners, is a national network of locally based organizations that serve families struggling with substance use and/or mental health issues. So all of you are affiliated with nonprofits around the country, and we brought this group together to foster collaboration, communication, help build capacity, and provide resources, both our resources at the partnership and your resources to be shared together amongst yourselves. I'm going to stop talking for 1 sec because there's people waiting to come in. I'm going to let them in. Okay, great. So as of right now, we have 127 members in 38 states, still growing. So this is your group. I hope that we'll get conversations going and have you collaborating with each other as well as with us. I'm not going to visit these particular pages because I did that in a previous meeting, but for those of you who are new, if you would like to share information about the program with any of the other nonprofits you work with, this is the link to Enroll. Most of you have visited that page and enrolled that way. You can find a national map of partners here and a state-by-state listing of partners here. If you visit those pages and you are not listed yet, be patient. There's like 4 of you that I haven't put up yet, but everybody else should be there. Okay, drum roll, please. Here is our new Community Partners Hub. I'm so excited about this. This is a password protected page that is just for you guys. And I'm going to visit it right now. So I'm going to stop sharing and then I'm going to share the other thing. Hold on, here it is. All right, here it is, Community Partners Hub. This is what it looks like after you get in. When you go to that link, it'll give you a little box that says enter password. The password is End Addiction, all lowercase, 1 word, and then you'll be onto this page. So what this is we have, this is a resource page for you all. And this is a little bit skeletal right now. We're going to fill it in as we go. But we have a section for events. Right now, I just have our meetings, today's meeting, our next First Friday drop-in, which I'll touch on in a minute. But here's a form for you to submit your events. If you have a gala, if you have a talk that you're giving, if you have whatever it is, if you would like it to be shared with community partners, you can submit it here. You also can email me. But if you submit it here, then I have the organization name, event name, event information, your links, and that just emails to me and then I put it up on the page. So I would love for you guys to start sharing your events, and especially since so much is done on Zoom these days. I think, if we can attend each other's events across the country, that would be very cool. Next thing, program resources. Here's our community partner badge. If you don't already have it on your site, please feel free to add it to your sidebar or your footer and link it to either this link, which is the listing of partners, or just to drugfree.org, so that people know that you're a community partner. Here is the contact sheet, which has been a long time coming. If you're not on it and you want to be, just email me and I'll add you. I had to get everybody to opt in, so it took a while to make it, but here, I'll click on it. Can you guys see it? It looks tiny, but you can blow it up. And it's got organization name, email, where you're located, and website. If you're on here and you don't want to be, if you've changed your mind, let me know. I'll take you off. Okay. So go ahead and go forth and collaborate. Contact each other. Let me know how it's going. The other thing is our LinkedIn group, which most of you have joined. Whenever anybody signs up, I go try to find you on LinkedIn and invite you to it. So a lot of you are already on it. But if you're looking for it and you're not on it yet, here's a link. You can go join it, join the conversation. Still pretty quiet on the LinkedIn group, but would love to see that become a better resource for everybody, and that happens if we use it. Currently, I'm using it to kind of remind people about our meetings, and if there's a relevant link or something, I share it there. Okay, this next thing is still a bit of a work in progress. This is our content library, and we have worked up some guidelines. Can you guys see this? Mm-hmm. Good. Okay. We've worked up some guidelines for sharing our content. Particularly things like the marijuana talk kit or the vaping talk kit. You're allowed to put your logo on the front page. You're allowed to add a welcome letter from the relevant person in your organization, and you're allowed to add a page at the end with your local resources. Send it to me so I can make sure it looks okay, and then you can share it widely. So these are kind of the rules. Going back to this, right now we have the marijuana talk kit is ready to go. The vaping talk kit is ready to go. I need to make some updates to the treatment roadmap and the family services flyer, but I wanted to go ahead and launch the page even though it's not ready yet, because our marketing and comms situation takes a little while and we'll get it done. But I wanted you guys to go ahead and know that this is existing as a resource for you, and we'll continue to develop as we go. Okay, and that's it for that. Any questions about that before we move on? Okay, I'll go back to my slides then. Share. I know I talked kind of rapidly there, so feel free to ask me questions as they occur to you. I'm not really checking the chat right now, so let me see what's going on there. Oh, thanks, Dawn. Okay, so that's our new community partner page. Very excited about that. That is something that I've been trying to get done for a while, and so I'm thrilled that it's finally happening. Next up, we're going to talk about the Safe Locator, and our Director of Product, Luis Torres, is with us, and he's going to give us a demonstration. I'm going to give you a little bit of background first. This resource has been in the works for a while. We've partnered with Safe Project, and I think Gina from Safe Project is here with us. Hi, Gina. It started as a way to develop a new user interface for the SAMHSA data, the SAMHSA treatment locator, which most of you will be familiar with, has great data, not a super user-friendly interface in terms of, what happens when families use it. Whoops. Okay, sorry about that. So we worked together with Safe Project to work on a treatment locator that used the SAMHSA data but was easier for families to use. And then we've added another component that's about family support services. And our staff, together with Safe staff, has kind of preloaded the locator with organizations' publicly available data, name, address, website, etc. And it's capable of having much more information, hours of operation, programs offered, resources offered, whether you have a helpline, things like that. So when this launches in a couple of months, everybody in this group will, and in a larger group beyond, will receive an email saying, here's your profile, won't you please update it? At that point, if you don't want to be in it, you can opt out. And if you do, we encourage you to log in and fill in more information so that more families can find you. Okay, so that is my spiel. And Luis, do you want me to let you share your screen so that you can do your demo?
Yes, please.
Okay, let me stop sharing, and I'm going to allow you to share. There you go, that should work.
Okay. Oh, sorry. You guys weren't supposed to see this just yet. So hi everyone, my name is Luis Torres. I'm the Director of Product here at the Partnership to End Addiction. I'm going to go ahead and walk through the tool. If you have questions, just please feel free to jump in. But again, this is kind of a sneak preview for you all to see, the app, how user-friendly it is, all the data that we'll be able to visualize, and also, get a good idea of like how people will be able to interact with it to find you all, but also other resources as well. And I'm gonna try. I know this might look a little small for folks, so I'll try to zoom in when I can. Right now, I'm going to show you the mobile optimized version. So it's the version that people will be looking at on their phones or tablets. And there's a very high likelihood that most people will be interacting with this tool via their phone. But we will also have a desktop optimized version as well. So this is the main landing page. When anybody starts with the tool, a little bit of information that it's about finding. This is a tool that's meant to help you find the right addiction support or treatment for you and your family. We'll go ahead and get started. Kind of right off the bat, based on some feedback that we gotten from other folks as well, is what type of help are you looking for you or your loved one? Depending on where you are or who you are, you might be looking for treatment centers, or you might be looking for other types of family support resources. We kind of wanted to avoid the assumption that everyone is immediately looking for treatment facilities specifically, and we also want to leverage organizations like your own as well to be able to highlight that in case someone's looking for different types of resources as well. I'm going to come back to the family support resources. I'll leave that towards the end. I'll walk through the user flow for treatment centers. And again, if you have any questions, please stop me. So the person, whoever is using this, would select whatever resource they're looking for. We're going to go with treatment centers. There's the next screen that they're going to look at. Let me zoom in here for. It's not letting me. Why is it not letting me? The next screen that we're looking at here is the kind of first array of questions that we're going to be asking folks. So who are you seeking assistance for today? Whether that's themselves, their children, their parents, a sibling, what is the person's gender, what is the person's age, so young adults, adolescents, adults, seniors, as well as their zip, and then how far they're willing to travel or that person or the person that they're looking for help with is willing to travel, and some questions about payment. These are all kind of the standard questions that we want to ask to be able to provide tailored results. Without these, there's not a lot of distinguishing between doing a general Google search, but this allows us to right off the bat provide really focused results. So for example, for age, if you Google substance use treatment center, you're going to get a little bit of everything. But for example, if someone selected adolescents, the system will be able to filter all of the substance use facilities that are specifically that have indicated that they specifically serve adolescents, as well as like payment options as well, and distance, as well as any sort of special groups. So for example, there are some facilities that are female only, male only, or maybe have a focus on serving the LGBTQIA plus population. So it's really just to kind of give a quick filter through all the results so they get meaningful information. The next screen after that, we kind of queue it up to say, do you want to see the results as is, or would you be open to answering a few other questions to kind of give you even more tailored results? We'll go ahead and click on continue to answer those questions. And again, we tried to create human-centered language that really allowed people that may or may not be too familiar with the substance use and treatment system to kind of indicate what they think they're looking for in terms of care. So what types of services is the person looking for? Looking for detox, outpatient, inpatient, MAT services, telehealth, non-clinical services as well. And it's really just meant to provide folks with an opportunity to, again, filter that information so that they, if they're not looking for a detox facility specifically, for example, they're not getting a bunch of detox results that are not part of their search. A question here about like co-occurring. So is this person someone that would benefit from mental health services as well? This allows us to filter results to say, we want facilities that also offer or focus in populations with co-occurring disorders, because there is, as I'm sure a lot of you know, there is a high likelihood that there's a co-occurring disorder for many people that have substance use disorder, but we also want to be able to provide meaningful treatment facilities for people that need mental health services as well. And then the next question is about whether they're part of a specific population. So again, LGBTQIA, veterans, court mandated, pregnant, postpartum, Native American, Indigenous. There's a few others that we're going to include on here, but these are just some of the examples that we'll have initially, as well as languages. So for example, a child might be, or a young adult might be filling this out for one of their parents that needs support in a different language, rather than the one that that they're using this in English, but maybe that person needs Chinese or Russian or Spanish. Again, we want to really focus on being able to provide meaningful results. So if there are treatment facilities that offer services in a specific language, that those get highlighted as well in the search results. And then the last question we ask is, what substance does this person need treatment and resources for? So for example, if they select opioids, we want to make sure that we include results like a methadone clinic or an OTP, as we call them here in New York. But for example, if they don't select that, a specific methadone clinic might not be, it's not relevant for somebody that's looking for alcohol care specifically. So again, it's also, just kind of help to filter and provide more relevant results in that initial list of results that we provide users. And so once they do that, they kind of come to this screen. They have another little kind of pivot point, which is, do you want to see the results? And we provide a little bit of a description of what types of results, but we also recognize that there might be people that are coming to the app in need of like immediate crisis. So by entering their zip code earlier in the app, this is going to get updated to list their local state 24/7 substance use / mental health crisis line, whatever it is that they might have. So for the sake of the mock-up, we were using a New York zip code. So it's tailored towards our New York State Hope line, but this will get updated. So whether you're in Utah, whether you're in California, in Alabama, in Florida, this will get updated to represent whatever your local crisis line for substance use disorder is. Let me see, I see a couple questions in the chat. Let me open it up. Taya, your question is, will there be resources for harm reduction? I'll come back to that, but I just want to make sure I follow up with that, so don't let me forget. Okay. And then so after this screen, they'll select. Oh, before I forget, after this screen, they can select to see the results, or we wanted to highlight this, but they'll be able to initiate a call directly from the app as well, in case they need to contact that crisis line. All right, and then so the initial results that we provide, they're going to be sorted by relevance and then distance, because we felt that, again, by asking those questions, we were going to be able to provide really meaningful results, but we don't want to exclude anything just in case, the most relevant result, for example, wasn't something that was particularly close to them. So, for example, in our search that we did to kind of show you these mock-ups, Equinox Inc. Counseling Center and Acacia Network were technically farther away from Hope House, so 0.68 miles and 0.90 miles versus 0.44 miles. But the reason why these are up here is because these matched the criteria that we asked before. So maybe it was around language or specific facility type or substance type or special population. These facilities, and we kind of list here what they include. So intensive outpatient mental health treatment, here for co-occurring. These are a little bit more relevant to what we were looking for, so we're going to push these up towards the top. But for example, maybe this distance, particularly in rural areas, for their most relevant hit is going to be too far. We still want to include maybe the 70% match, the 60% match, because maybe that's just closer and it's just much more feasible for them to go to those treatment facilities. So we want to just make sure that we don't exclude anything and include them there as well. All right, and then from this view, you'll also be able to go into a map view. So, we've all used Google Maps. Sometimes it's easier for folks to visualize this as well, versus specifically, they want to see where they live in comparison to where the facilities are, and that also helps them make those choices. The other thing, which we'll go in a little bit more detail, is from this screen, someone will also be able to toggle into support resources. So I'll show what those screens look like in a second once we come back to it. But we also want to say, maybe somebody comes into the tool thinking that they want a specific type of treatment, but in reality, maybe they realize as they're doing the search that, going to an outpatient clinic is not what exactly they were looking for. So we want to give them the option of clicking on support resources to find organizations like some of yours that are on this call. And I'll click on these cards just to show you what the expanded view looks like. So again, they'll be, you'll get your phone number, email for every facility. You'll be able to launch a call or launch an email directly from these. We'll provide hours, payment types accepted, services accepted, and a bunch of additional information that may be useful to the person that's doing the search. We'll also include information on when this was updated. This is SAMHSA data, so it's updated every year, but there are obviously going to be some gaps in there, so it's important for people to know how recently this data has been updated, as well as your ability to share this. You'll be able to save this specific site or treatment facility and share it via whatever platform you want, as well as bookmark it for a later time in case maybe you get pulled away or you want to just make sure that you note it and come back to it. So that's kind of the end of the road for the treatment facilities. In terms of the tool itself, again, a user will be able to scroll down, look through all these different ones. They'll be able to contact them, share it, save. There's no limit to what they'll be able to do with it. So let me go back to here to the main kind of the first initial breakpoint and click on family support. Some of the screens will look very similar to you, but some of these questions have changed. So for example, we're not including questions here around payment, just because it's not necessarily, it's not a healthcare treatment facility. So there's not going to be a need to, provide your Medicaid card if you need it. But we still want to, but based on the information that we have, and kind of going back to what Liz mentioned, that we'll be asking you in the future if you want to be a part of this to update your information to make sure it's accurate. All of these questions will help filter to be able to link people in your communities through this tool to you. So we'll still be asking, who you're looking for services for, what's that person's gender, what's that person's age, what's their zip code, how far they're willing to travel as well. Some of the questions that we're going to ask in continuation are going to be a little bit different. So what kind of family support resources would this person prefer? One-on-one, in-person support groups or online support groups, or they also can be unsure. You know, does this person need support in a specific area of substance use and or mental health? You know, they can click on other types of support as well: grief, prevention, recovery. Again, do they prefer a resource, again, focusing on the specific population, you know, active duty, faith-based, you know, Latinx, Native American, children of adult parents as well as any other languages, including sign language. SAMHSA unfortunately doesn't collect that data, but the data that we're going to be using to help filter to family support groups or family support organizations is American Sign Language is included in there as well. And again, they'll be coming back to this pathway where, you know, maybe they started initially thinking that they wanted to find some community resources, but they again might have some sort of urgent crisis that needs to be addressed. So again, you know, in this case is if somebody entered a Pennsylvania zip code, you would link them to this Pennsylvania hotline and be able to launch a call directly from that app in case they are in crisis. And again, we come to the results. Again, these are sorted by distance, by relevance and then distance. Again, these are just examples of organizations that we pulled. This is a good example. I'm not sure why it's not letting me. Let's see if I can make this a little bit bigger for you guys. I'm not sure if that worked, but this is a good example of, you know, a family support organization and why it's super important that when you all get the email to look through your information, that you provide as detailed information as possible, because we want to give everyone as much information as we can, including your mission, your costs. Most of the time it might be no payment or a free service. You know, what types of groups you offer, what types of one-on-one support you offer, what types of recovery tools or preventionary tools, you know, what type of age groups you work with, any sort of cultural focuses, language focuses, any other groups that you work with. This is an example of one that's like made up, but of an organization that didn't provide a lot of information. So you see here that there's like non-listed, you know, maybe one toolkit. The more information that we can, you know, provide the users, the more likely they are to be able to find meaningful information here. And we also want to accurately reflect what every organization offers as well. So let me go back here. And then here's an example of an organization that was a little bit more thorough in their feedback. So they provide, you know, in terms of their mutual aid groups, they provide secular meetings, they do online support meetings, forums, and groups. And their one-on-one support, they do peer support and referrals to professional supports. They also have prevention tools such as educational classes, workshops, trainings, public awareness, volunteer opportunities, school age, K through 12, focused prevention and education. They serve young adults, seniors. They have some bilingual. They also serve, you know, parents of adult children, for example. So again, the more detailed information that we are able to provide, we want to accurately reflect what organizations provide for anyone that's using this tool. So I will pause there. I'm just going to kind of keep it on this screen. I want to go back to in some of these questions. Sorry, Tanya. Could you elaborate a little bit more on your harm reduction question? Is there a specific type of resource that you were referring to?
Well, actually, there wasn't. I just was wondering if a family member or someone interested in seeking services would be interested in having somebody walk with them until they're fully ready for abstinence. Are these variations, you know, is there a platform for these variations to be provided? And it may or may not come under non-clinical services. Mm-hmm. So, you know, just pretty much around that, and that concept and idea.
Yeah, and to go back to that, so the non-clinical services in the treatment facility, pathway was more about like if they off, if a specific clinic, for example, also offers peer support and things like that. If you're not a facility that's captured within the SAMHSA data, then they're gonna be listed. If they are part of this cohort that we're trying to include, they're going to be included here in the family support. So as long as we have information around that, we'll include it here. That original, I think when you asked the question, those were facilities that offer specifically healthcare-based services, but also may offer some non-clinical focus support as well.
Yeah, I kind of jumped on the non-clinical part of Dawn's question because I was looking at like harm reduction services, supporting people around everything they need until they approach the, the idea of wanting to be drug-free or totally abstinent, and working with them around those spaces, to provide or to help that people won't lose their lives or anything like that. So I just was curious because somewhat of the work that I plan to do is around that. And, I'm just taking a risk here.
Tanya, the answer is yes. And we have Gina with us from Safe Project, who is a big part of putting together the family services side of the house. So Gina was messaging me directly, so I wanted to give her a chance to speak and introduce her to you guys as well. So Gina, can you say just a quick little hello?
Thank you, Liz.
Yeah, thank you. And thanks for all the questions. As part of the background, I mean, part of this comes the impetus for having this was my own family experience and not being able to find what I needed. And then also, as I've come in contact with other families and other individuals, there's no one size fits all in terms of resources. So yes, we're starting with, we're including harm reduction. We include 12-step, non-12-step. So it's everything that you could possibly want. I mean, there are religious based organizations. There's Buddhist, there's yoga. I mean, you name it, we've got it. The only thing we're really looking for is we want them to be reputable and not for profit. We're not looking to add organizations in that are making a buck off of other people's substance use disorder or mental health issues. But yes, harm reduction is in there. I will let you know. So we don't have for family support organizations, as Liz and Lewis can tell you, there is no SAMHSA locator where you can easily pull up family recovery family support organizations. So we are hand pulling all of this. It is a lot of Google searches, state by state, and gradually getting people to register with us. And Liz can probably explain a little bit more about how we're adding people in, and then we're going to ask people to basically own their page. But we've actually, one of the things I just finished yesterday was parents of addicted loved ones had shared their entire list of all of their groups nationally. It's about almost 180, 190 groups. And just finished that yesterday. But to do that, we have to download their list of all their meetings, and then I had to go in and add all the email addresses. So, if any of you have, I put my email in the inbox, and you've obviously got Liz's. If you have harm reduction groups in your area that you want to recommend, I have a feeling with everybody that's on this call, we probably have yours. But please send them our way. I'm happy to add them myself and just get them into the basic locator. And, this is I kind of call this all hands on deck. So if you want to recommend somebody, another organization, harm reduction, anything that any other organization you're working with that you think would be a good fit for family support, just send them our way.
There's a lot of overlap in terms of the kinds of organizations that we have in community partners and the organizations that are right for the locator. So as you refer people to community partners, we're glad to have any nonprofit that has a substance or mental health focus around the country. And we'll also kind of feed their public information into the locator so that they can then update their profile or, opt in or out. So thanks for that, Gina.
And let me add something towards Don now that I've read some of your comments. I think what you're also kind of indicating is that it would be great for there to be a visual way for people to distinguish whether a specific provider organization is harm reduction friendly or versus they kind of believe in an abstinence only model. I think that's something. It's an interesting point and something that actually I don't know if we've had a lot of conversation about, but that's something that I will definitely take note of. Obviously, it depends a little bit on what state you live in and kind of what the dynamic, like what the healthcare treatment system looks like in your community. Some states there's a lot more focus on harm reduction versus abstinence only, which might not be the same thing in other states. So I think that's that kind of visual representation is actually something really interesting that we'll take back, and that's really good feedback for us to keep in mind.
Okay. Thank you so much, Luis. Is there any more? We're starting to run a little bit low on time, so I want to make sure we've covered everything, but also give enough time for our next thing. Do you have anything else to cover, and then maybe you could stick around for the sharing at the end?
No, I'm good, and I'm happy to answer any questions directly if anyone wants to message me while I'm online.
Great, thank you so much, Luis. Appreciate you being here and showing us the locator. Okay, I'm going to go back to my slides. Share. Back to the thing. Okay, good. So next up, we have with us Darlene, who is from USARA, and she's going to tell us a little bit about her organization. So Darlene, if you want to just, when you're talking, just tell me to go to the next slide, and I will do that.
Okay, sounds good. So I'm Darlene, and I'm from Salt Lake City, and I'm from USARA or USARA. We can pronounce it either way, and that's Utah Support Advocates for Recovery Awareness. And you can change to the next slide. And I'm the Craft Family Support Coordinator, and that's okay. Go ahead and jump to the next one too. I'll tell you who we are. So Utah Support Advocates for Recovery Awareness, USARA or USARA, we're a nonprofit recovery community organization in Utah. And within our organization, we have 4 recovery community centers here. Our main center is located in Salt Lake City. So we provide non-clinical recovery support services, no cost to receive any of our services, and we celebrate all pathways to recovery. So whatever recovery looks like for our participants, our staff, and our volunteers will support that. Our mission is USARA connects and inspires communities to advocate for addiction recovery. We envision a Utah where recovery, community, and connection are recognized as the most valuable asset for people to recover from addiction. And you can change. So the services we offer, other than our Craft Family Support Group, are peer recovery support services. Our peer recovery coaches provide that non-clinical support using their lived experience in addiction and recovery to help assist those wanting to initiate and sustain the recovery. So participants can walk in, we're a walk-in center. They can walk in and meet with a peer recovery coach one-on-one. They can do it over the phone, they can do it over Zoom, just to make that connection and meet them where they're at. They basically sit by them and say, what's tomorrow look like for you? What would you like it to look like? How can I support you? We have another program called ARCHES, Addiction Recovery Coaching in Healthcare and Emergency Settings. And this is where our trained peer recovery coaches they deploy into the hospitals, and they meet with the participants that have overdosed or are there for any addiction related cause, and they make that same connection. These peer coaches are trained in hospital protocol, crisis management, harm reduction, suicide prevention, mental health first aid. They deploy 24/7, and they deploy within 1 hour of the phone call from the hospital or the family's members at the hospital. Our hospital and healthcare partners throughout Utah welcome this support. You can change it. So I am in charge of our Craft Family Support Program. And the way I found this program is in 2010, I had 2 sons struggling with an opioid use disorder, and I had nowhere to turn. I was at a loss as to what to do. In 2010, they didn't have the billboards that talked about opioids. They didn't have the things in the hospital, in the elevators telling you about the, be careful with the opioids. And my youngest son went to the doctor and he had a back issue. And I told him, whatever you do, don't get Lortab, whatever you do. He came home with a prescription of Oxycontin. And I was seriously like, at least it's not Lortab. This was in 2010. I had no idea. Within a few months, he became dependent on that and moved to heroin. And then my oldest son jumped in out of curiosity. So now here it is, 2010, I have 2 sons struggling with heroin use, and it was like a runaway train. I was trying to fix them before anybody found out. That shame and stigma hit me hard. And I was a first grade teacher. I didn't want parents to find out because I was afraid they'd think I was a bad mom or I had bad kids. And we always say recovery is not about making a bad person good. It's about helping someone sick get well. I didn't realize that back then. So I tried to stop it on my own. My son's counselor reached out and said, we're starting a program called Craft Family Support at USARA. And I really think you need to come join this group. And so this is the group that literally saved my life. It opened my eyes to addiction. It opened my eyes to what my kids were going through. Within 3 months, I had learned some communication tools, ways to help my loved ones, and my boys got better. My oldest son, it'll be 11 years in September that he hasn't used heroin. And my youngest son did really well for a long time and hit a little bump, had an instance of use, and in 2012, we lost him. But he's my inspiration to keep this program going. So you can change it. So what is CRAFT? Community Reinforcement and Family Training. It was developed by Robert Myers as an evidence-based clinical model for helping family members engage their loved ones into treatment. So what we've done at USARA is we've modified this CRAFT model to be facilitated in a group setting and facilitated by family support coaches like myself, who are family members with that lived experience. So the goals of our program: reduce your loved one's harmful substance use, engage your loved one into treatment, offer that recovery support, and improve you and your family functioning, emotional, physical, and relationships. So how does our program work? I forgot this is one that you have to keep going. There's 12 sessions based on chapters and Get Your Loved Ones Sober. And you can, this is the book that we use. And then we've also at USARA, we've written a workbook to go along with we call it the sober book. We don't focus on that word sober. We focus on the subtitle, which is alternatives to nagging, pleading, and threatening, because that's what we do as family members. I know that's what I did. Nag, plead, threaten, negotiate recovery over and over, not because it works, but it's all we have. So we teach a new approach. Participants can show up anytime at our group. There's no registration required, no charge for any of our classes. The materials can be picked up at our center. We have a weekly lesson, homework practice, and then group sharing. We teach effective strategies for self-care, using that oxygen, or the airline analogy, put that oxygen mask on yourself before your loved one. We also do the Narcan and naloxone training. Each participant is provided a kit. And all of our groups are led by family support facilitators with lived experience. So what are our options that we have available? We have our group sessions. They're 90-minute group sessions facilitated by our coaches. 10-minute opening. We do a 20-minute homework review. Most of our homework, the activities are done in the group, and their homework is basically to go home and practice those skills on their loved ones. We do the lesson, the chapter review activity that takes about 30 minutes, and then our group sharing. Again, we close with our naloxone and Narcan information if needed. We work with Utah Naloxone to get our kits. Everybody is provided a naloxone kit or a Narcan kit through our health department. The other thing we offer is individual phone coaching sessions. This is a benefit of joining our CRAFT groups. They are offered a 30 to 45-minute phone call or Zoom in person with a trained CRAFT facilitator. And the goal of the call is to offer that recovery support and work with those CRAFT skills from what they've learned in the group. Encourage attendance to the CRAFT meetings, of course. Those support groups are so important. Encourage self-care, offer those resources that are needed, and then make an appointment for their next session. So right now in Utah, before COVID, we had 17 groups in 12 different Utah counties. Those were in-person groups. We started some online groups. Since COVID, we've moved a lot of our groups online. We have a Monday online group, which is just the introduction to our program. Tuesday online Women's Craft Connect self-care support group. This is not a lesson there. It's just a self-care group for women using that craft language. Tuesday online is a Craft Connect group that doesn't use our book. They use a PDF. Wednesday, Thursday online is our normal group with our book and workbook. And then we're happy to say that we now have a Spanish speaking support group every Wednesday night. We've translated all of our materials into Spanish and we've got that up and running. The other 5 groups are in-person groups throughout Utah. So how do we know our program works? How do we, I know it works because I see people, family members getting better. I see their loved ones getting better. But what does success look like? So USERRA's partnered with the research team from the University of Utah to establish a science-based development, implementation, and evaluation of the Saracraft family model. And this is to measure the level of change and effectiveness of our program. So our family participants complete 2 surveys within the 12 weeks of our program. And right now the reports are showing, they're demonstrating very positive results. Those family members are gaining that knowledge, the skills, and the confidence they need to help improve their family well-being. Their emotional well-being is improving along with their loved ones, and they're seeing a decrease in their use of drug and alcohol. So we like to end all of our groups with the 3 things rule. Things in your life can get better. Things in your life can stay the same. Things in your life can get worse. The choice is yours. And so this is our contact information. Our website is www.myusera.com. And then we also have a craft support page on that has a locator for all of our groups. And then we're on Facebook as well. I tried to talk real fast. I know we were short on time.
Thank you, Darlene. I appreciate it. And you've made it under the wire. Thank you so much for being with us. And guys, I'm going to share the slides after our meeting so that you can refer to this stuff if you would like to. We're going to go into upcoming events and resources. We're going to run into 2 o'clock, and I know some of you will have to jump for other appointments, but I will stick around and we can continue and have our open share and Q&A in the remaining minutes that people can stay, but I know some of you will have to go. So we'll try to quickly get at least through the rest of the agenda. So upcoming events and resources. Denise is with us and she's going to tell us a little bit about both Mobilize Recovery and Changing the Addiction Story. And then I'll talk about Raising Resilient Kids. So Denise, take it away.
Thanks, Liz. Before I introduce myself, I just wanted to thank Darlene for all her amazing selfless work. It's why I like the community partners and the whole theme about this. Darlene, I'm getting goosebumps. We met probably 8 years ago in Boston, and we both, had this vision of supporting families and the silver lining to look back over the 8 years and just see the tremendous work that we're doing to help other families. So I thank you for that. And I'm forever grateful for our friendship and all our collaboration. So thanks, Darlene. So I recognize so many people here. For those that don't know me, I'm the Director of Family Support and Advocacy at the Partnership. I do a lot of what Darlene does, so I won't go there, and I will concentrate on the events and resources. So 2 things that are upcoming, and Liz, maybe you could put my email in the chat if anybody has questions, because I know people have to jump. So Mobilize Recovery. This is a new conference that began 2 years ago from the recovery community. We were blessed and thrilled last year when they approached us and said, would you do a family track? Which was a dream. Who thought the recovery community would come back, not only think that families could be part of the solution, but offer us to do tracks there. So we got super involved last year. We had a few breakout sessions and plenaries. And the outcome of that on both sides is just fills my heart. We probably gained, probably 30 new coaches, probably 100 new volunteers, because so many families, as Darlene said, just felt like you know, at every turn, the door was closed. We didn't know what to do. We didn't know there was millions of us out there supporting one another. And on the other side, on the recovery side, they just felt like they understood the family journey a little bit more. You know, so often we're labeled as codependents or enablers, and they just don't understand the family journey. So we're going back again this year in September, half in person, fingers crossed, but then another, you know, 2,000 to 3,000 will be able to attend virtually. So we will be having tracks again. And if you want information on the dates, we are doing family recovery versus individual recovery is one of our breakouts. Another one is the role of families in advocacy. And then we're going to do a plenary on tech, but also the silver lining of COVID. And Darlene hit upon that a little bit, just, you know, the ability to reach hundreds of thousands of more families virtually. So whether that be our, you know, coaching program, our online support groups, there has been telehealth, I could go on and on. So anybody wants any information of what those dates are, I could share that with you.
Denise and Marcia are going to be there in person. So
Yeah.
those of you who will also be there, you know, let's organize some kind of a get together. Let us know if you'll be there so that we can meet up.
Thanks, Liz. And in addition to that, we are so blessed to have a story activation there as well. So we're hoping hundreds and hundreds will share their stories with us for a whole lot of reasons. But what a great way to segue into just another project that we're working on, which is Help Us Change the Addiction Story. We got funding over a year ago, and our first jumping off point was to create an advocacy toolkit, which I can share with you guys, or maybe we could put the link in. And then the second phase was we really wanted to illustrate the power of stories and advocacy. So what we know are individual stories are powerful ways to illustrate and humanize the various barriers and challenges that people with addiction and their families face. We know that the addiction journey is marked by systemic challenges and barriers. And what we also know, and I think, you know, many of us, sorry, I thought I muted, know on this call is, you know, too often we blame the people for the difficulties they face in their addiction journey rather than failed policies. So we launched this, we did a soft launch last week. These are all personal stories. We could just kind of go up and down, Liz, for a second, and then maybe we'll select one where we use that personal story or moment of that story. If you think of the family journey, whether it be parity, lack of any kind of treatment, denial of treatment, denial of medications, no wraparound support. So maybe if we click on Virginia's up top, what we do there is just highlight that moment. So for Virginia, it was a lack of insurance policy. So if we scroll down, we see a little bit of the problem that Liz faced, but then as we go down further, we have the solution there. And so what we'll describe the problem, but then we'll also connect you to one of our action alerts and current legislation that is supporting this barrier, so to speak. So this one would be the Parity Act. Same thing, if any of you are working with MOUD for medications, that an example of that solution might be the X waiver that's gaining a lot of traction now. So we wanted to use the power of stories to really illustrate this very long journey. We actually, and sadly, identified 54 touch points and barriers along the way, and we're collecting stories. Liz has put in my email. Again, if you have any questions, we have a webinar on this and can send you some information. So super excited. We launched that last week, and just grateful that we can also, while this is an advocacy tool, we are already hearing a week out that parents are coming in here and saying, not only do I not feel so alone, I know there's families out there that have faced the same barriers and challenges. And again, just connecting with one another and so forth. So it's really a source of hope for families that they're not alone. There are solutions and we're here to support them. So that was a whole lot in 5 minutes, but I just want to be conscious of your time. So thank you.
Thank you so much, Denise. Appreciate you talking about that. And guys, our next newsletter will include some information about this, and I'll be emailing you about Raising Resilient Kids. I know people have to jump, so I'm going to be quick. I'm going to very briefly touch on this just because it's coming up. I'm working with Linda Richter, who's in our policy and research department, to put together a guide called Raising Resilient Kids. And this builds on a program that we had on the CASA side of the house for years called Family Day, that deals with protective factors that helps kids grow up strong. So mental and behavioral health, physical health, vaccinations, nutrition, sleep, as well as safe and supportive communities and family bonds. So we're going to be coming out with a guide, and we'll have a related webinar in October, and I'll be sending you more information about that. Just wanted to let you know that that's coming up. Lastly, a reminder, First Fridays, I show up on Zoom and you guys come hang out with me. And we've had a couple of those so far and they've been great. Thank you to those who have showed up for that. We've had some really great conversations. We've had some really great nascent collaborations of people meeting each other or learning about their organizations and saying, hey, you know, I should get you involved in this. And it warms the cockles of my heart to see that happening. So just a reminder, first Friday of every month at 1 o'clock, hit that Zoom link and come have a cup of coffee with me. I'm just there, so come on down. And that's it. So I know people have to go. I'm going to stick around as long as people are still here. And let's hear what's on your mind. What questions do you have? What's happening with you?
I'd just say quickly that we do use your PowerPoints to do parent education and that kind of thing. And we do put our logo in, update just a tad on the beginning and the end, but they've gone over really well. And I think COVID has been really hard on everybody, but the fact that we can do some of this stuff online, which I think in person is hugely important, but the fact that like we're doing a mental health summit, we're doing an alcohol awareness night, we're doing an opiate screening of a national film with panel that can be shared with everybody. So even though we're doing mainly things local in our area, it's great to connect with you people who we can all share what we have because you just watch it on a screen. So I'll let you know about those in the future, and thanks for all the stuff that you bring to the table.
Thank you, Laura. I agree. There have been, as difficult as COVID has been, there have definitely been some silver linings in the way that we all work together. In fact, having a webinar about COVID back in April of last year was how this program got started kind of sooner than we were planning to do it. So it was definitely an accelerant for some things. Anybody else? What's going on?
Liz, this isn't really something going on, but is it possible for me to get the recorded version of this?
Yep.
I've got, finally, for the first time ever, we have a semi-paid person helping Not One More Alabama. So 5 years in the making. And so a lot of the things that you have shared, especially at the beginning of the tools, I want to be able to maximize on. And I should have had him on here, but I didn't think to do that. So I'd love to share all this with him.
Sure, I'll send her on the slides and also a link to the recording. It takes me a couple days to get it onto our YouTube channel, but once I do, I'll send it around.
Perfect, thank you.
Mm-hmm.
Hey Liz, I'm just wondering, I just had a look, the contact list is amazing. Is there any possibility that you can share it on the hub in Excel format as well? Just so that we can sort when we're looking to make connections with people in a particular state?
Yes, I can do that. Contact sheet. That's a good idea.
Hey Liz, I had a question too on the hub where we can put our various events and things going on, and other people will put theirs. Other than routinely going and looking at that, is there any way that we would receive email, digest form, some kind of notification that people are adding things to that hub? I don't know if I would remember on a real regular basis to look at that to make sure I'm seeing what everybody's doing. I didn't know, but I you know, at the same time, I know nobody wants to be getting notifications all day long, you know, of everything going on there. But just something, if there's a way to somehow alert us that there's new information on there or something that's not an overwhelming thing, that might be nice. I'm going to try to remember to go look all the time, but I might.
I think that that's going to evolve as we go along. Like if we start having a large volume of events, I'll probably move it into like a Google Calendar or something like that you could subscribe to. Since there's not really anything on it yet, I thought I'd just start with a list and we'll see whether people use it or not. So I think while it's still short like that, I'll just include it in our monthly newsletter. And then as it gets more and more robust, we can figure out moving it to something where it'll notify you more regularly.
I do like that Google Calendar idea. That's a great idea.
Yeah, I think that's probably where we're headed. I just, until I had something to put in there, I didn't want to set it up yet. Okay. Oh, by the way, a bunch of you have put some events in the chat. Could you please do me a favor and email me that? Because for some reason, it's not letting me copy the information out of the chat. So if you put an event in the chat, please email me as well at lcairns@toendaddiction.org. Hopefully you have my email already. Or you can go to the hub and submit it through the form, just because I know it's going to vanish once I end the meeting. So that would be really helpful. Thank you.
I have a question. I'm Olga from Early Bird Alliance. We are a new organization. We're 1 year old. And so far we're doing kind of very little. We're only on Facebook, so we're sharing information. And we're still trying to decide what is the next step that we would like to do. We are in prevention. And I wonder, I would like to have something like a roadmap. So we would like to follow some established kind of pattern. For example, step number 1, do Facebook. Step number 2, go on Instagram. Step number 3, share stories from partnership to end addiction. So I understand that I can develop it by myself, but I think if there was something like that, like some kind of skeleton for new partner. So like saying that this is those are the steps that somebody who was successful did before. That would be so wonderful. Then you don't need to think, am I on the right thing? Is that something that I need to do? Because it just takes a lot of time, and even like thinking about it, thinking that, oh, I need to think what to do. And by the time you sit, you're just exhausted. So I think that I really kind of would appreciate if I could get some kind of help on that path.
Sure.
Olga, we just had our spring conference here in Idaho, and one of the we had a we revisited our action plan, or not action plan, but our strategic plan that we did in October of last year. And one of the new elements that have come out of that is a buddy program. So it's a prevention buddy program. So if you could send me an email, we could, I could talk to you and see if we might be able to partner you up with a coalition that has been operating for some time, and they might be able to kind of come alongside and support you as you guys grow in the prevention field, and we can help get you guys into a full-blown coalition where you're looking at applying for grants and deciding whether you're going to be a nonprofit and all of the fun stuff that comes along with it. So if you don't, I'm gonna throw it in the chat again in case you didn't see it.
Okay, sounds good. I'll pick it up.
Thank you, David. That's a big help. I was going to say that because there's so many variables with local organizations, it would be hard for us to create a skeleton around that in terms of, you know, what you need to do locally to get yourself set up and programming. But what I do think we can offer support about is connecting you to the other partners like David who have those kinds of resources. So if you wanted to maybe say something in the LinkedIn group, you know, like I'm looking for advice on this particular topic, I would love for other partners to log in and you know, and offer your opinions and thoughts on that. I'd love for that LinkedIn group to become a forum for that kind of help, where you all can offer each other your support that way.
And if we can help in any way too, if you want to share a little bit more about what you're doing, Olga, we have many training webinars. For example, we're in the midst of, you said you started on Facebook. We just completed our social media, right? And so we know that families, the traction is through Facebook. But we also know that Twitter is a great way to collaborate with other, organizations and DFCs. And we also know that Instagram is a big family traction. So if you ever want to give us just a little bit more information, we can help in any way too, especially as it relates to families and how you can engage and support them. Be happy to help.
Yeah, it's not really a one size fits all, but there's a lot of support, kind of issue by issue that we can help with.
We're
Right.
here to help. Although we got you. We got your back.
Okay, perfect. Thank you, guys. And I'll post on LinkedIn, right? LinkedIn my questions. Thank you.
Thank you, guys. Anybody else before we run along?
We do have something over at CCI that I took on a very regional tour, and it has been working quite well. We picked up, started running a podcast based off of prevention. It's called Let's Talk Prevention Idaho, and what it basically is a educational resource for coalitions across the state of Idaho, our coalitions and our partners. We've seen a lot of intersection with mental health and substance abuse and prevention with COVID the last year and a half. And we actually had a interview with a gentleman from Austria who wrote a couple books called Alcohol Review. It's basically looking at the social, advertising, and environmental impacts of the way we look at alcohol. And what's kind of funny is we posted the podcast the same day that Boise State decided to publish that they were going to be selling alcohol at football games this upcoming season, and it kind of blew up. And we've have interviews with Dr. Ken Finn, Aubrey Adams on the marijuana issues, and I would love to, if anybody has a prevention program that they would like to get the word out, they'd like to talk about that might be of a benefit to us. And I know I'd love to hear from you and get some opportunities, and I would love to you guys to check it out. We did go over some of the stuff on when the DFC got taken over by the CDC. We are the last marijuana-free state in the country, completely marijuana-free. So we are doing a lot of stuff around the guise of marijuana and the initiative process and signature gathering and youth harms and stuff. So it's a really good podcast, and it's also, I'd love it for it to be a resource if anybody wants to jump on and be interviewed, to shoot me an email and we'll get you on.
Yeah, that sounds like a great resource. Thanks, David. So we are down to 8 folks, so I'm thinking maybe we should wrap it up. Thank you all so much for being here and listening to all of our things. And if anybody has questions that come up, feel free to email me and we'll be in touch soon.
Hey, Gina, and if you need any help on populating the harm reduction, I'm an email away. That's a big advocacy, and we have lots of resources from the state teams at RAP. So
awesome.
Thanks, everybody.
Thank you.
You guys.
Thank you, everybody.
Bye.
Bye.
Thank you.